my name is Dr. Fellman. I'm with the Center for Health and Wellbeing. I'm here to talk to you today about tips when starting diet change. So first thing you want to do is plan a start date for your diet change. So normally I recommend people start on the weekends so they give time to really figure out how the diet is going to affect them, and it gives them time to prepare. The next tip that is for diet change is to really notify the family before you start a diet. So letting them know what exactly the changes are going to be, and also letting them know that it's not about forcing them to change. It's really about you feeling healthier and happier in your life and with your health. And so finding an even ground between you and your family when you start changing diet is really important. Some people are very open to changing within the family. Other people are not so open. So understanding the ground rules before that happens is really vital to sustaining your diet plan, because studies have shown that more people who have family support, they're able to actually continue their diet changes longer. A second tip when you're starting is really preparing the household. So one of the things in preparing the household is gathering the right tools for cooking. So as you change your diet, you might notice that you need different tools than you needed before because you're making different types of food. So learning what those tools are, whether it's a blender or a zoodle maker or some other form of tool that you don't normally use, get those ahead of time before starting the diet, and look up recipes ahead of time to see what things you might need that are different than your normal. Restocking the pantry is another one of those things in preparing the household. So when you go through your pantry, you may find a lot of foods that you actually cannot have with the diet. Most people choose to either throw away or give away those foods. If you have family members that are also eating those foods, sometimes even putting a separate area of the pantry for yourself can be helpful, because that helps you know what is off limits and what you can eat. Make sure that if any of the practitioners here at the center, including myself, are giving you food plans, that you read through the actual plan thoroughly. There may be some details to the plans that we're not aware of, and so it's really helpful to get an idea of what the plan lets you eat and not eat. Some plans, like elimination diets, they're more strict, and you really do have to eliminate certain foods, and that can be a little more challenging than just changing the servings of one particular food to another. When you're buying your foods at the store, make sure to read food labels. Reading food labels is really important, and it's one of the biggest mistakes that people make when they're changing their diet, because they are not actually looking at hidden ingredients that are actually in the nutrition panel or in the ingredients list. So especially for those who are doing any kind of elimination diet, some foods are a little tricky, and foods you think normally shouldn't have any hidden gluten or corn end up having them. So just be very particular about your foods and make sure you're reading the labels for that. Other tips would be to look at restaurants. And some people might think, well, why would I do that? The reason is we can't always cook at home all the time. And sometimes it's good to know some go-to foods ahead of time in case you're traveling, or in case you don't have time to make your own food at work. And so a lot of times, many common restaurants will actually have ingredient panels now on their websites, including places like most fast food places as well as Starbucks, but even some other restaurants that are healthier can oftentimes show their ingredients. It doesn't hurt to call the restaurant too and ask them if they have like gluten-free options or grain-free options for some of their foods. And it lets you know ahead of time what's off limits and what you can have. Meal prepping is part of this plan as well. And it's a large tip that I find is most helpful for me personally, but also other patients. And basically that helps you avoid pitfalls. So if you're prepping ahead of time, you can make food in bulk, you can save it or freeze it, you can refrigerate it or pre-cut vegetables. All of those things are very helpful when you're changing your diet, because then you always have a backup plan. Make sure that you're always keeping snacks on you and that you never go hungry, because most of the time when we cheat or go off our diet, it's because we're hungry and we don't have other options. So It's always good to track progress as well. So once you start the diet, it's almost good to do a before and an after. So what I usually recommend to patients is take a picture of your food if you have a smartphone or any other device, or just write a journal if you don't have that technology. And one of the things that does is it helps you see how far you've come with the diet plan. And it helps when you bring in either the diary or pictures to me or another practitioner to look at what exactly you're eating. There may be small tweaks here and there that can make a huge difference in the result that you want to obtain. And sometimes pictures are a little bit easier to see your plate and your food. The last couple things are, give yourself regulated breaks, but also give yourself a break in a sense. It's not about being perfect. And so it doesn't help to beat ourselves up if we make a mistake or if we go off the diet temporarily. We will fail on occasion, and there is a difference between making a scheduled, educated decision to go off the diet versus one that's made out of desperation or emotional eating. So give yourself regulated breaks from the diet as needed. I know for some people we change the diet or allow ourselves a break on certain holidays or certain special events, just knowing ahead of time that we're going to do those things. For elimination diets, that's a little more tricky. Again, elimination diets are more short-term diet plans, and so there really is a stricter adherence for that. But for other long-term diets, it is okay to give yourself a break here and there. And then at the end of it, it's not just about what you're eating or how much you're eating, it's how you're eating it too. So the way we look at food and the way that we consider food in our lives, I think makes a big difference. It's good to ask yourself the question, is food just kind of a means to an end so I can get through my day? Is it an inconvenience? Or is it something that you love to prepare for and sit down for and have social time around? And so understanding, the environment in which we're eating our food and being conscious of that can make a huge difference, not only in our experience, but how we digest the food, how that food operates in our bodies, and what our body ends up ultimately doing with it. And so those are some of the tips that I have. Again, my name is Dr. Fellman. I'm one of the functional medicine practitioners here with the Center for Health and Wellbeing, and it's a pleasure to talk to you today. Thank you.